The area that it's my niche now, I guess, if you can call that, and it's really my mission more than my research. It's called healthcare transition,
Mhm.
and it's dedicated to help adolescents and young adults transition from the pediatric services to the adult healthcare services, adult focused healthcare services. I actually told my mom, I want to be a nurse like you, Mom. I want to help patients like you. And she said, oh, no, honey. I was 6. She said, oh, no, no, honey. You don't know how to take orders. You know how to give them. I think you need to be a doctor.
Welcome everybody to an episode of TAOL Global, a podcast by TAOL Project, where we strive to help people align their actions with their core values and what they want to become in life. We want you to be successful and we want you to find your strengths and make the best out of life. For that reason, today we have a very special guest, someone who is a person I deeply admire as a professional. I would say she's like an institution herself by now, but also at a very personal level because she's one of the most caring people I've known here. When I moved from Mexico to North Carolina, she made me feel very welcome, like if I was part of a family. Because for us as immigrants, sometimes it's hard to find that group of people that makes us feel like ourselves. I want to welcome Maria Ferris, Dr. Maria Ferris. How are you?
I'm fine, thank you. And I'm so glad to be here today. And yes, you are family. You're my sobrino. You're my nephew. Dra Maria here.
That's right, Dra Maria. How do you want me to call you today? Dr. Maria Ferris?
Dra Maria's
Dra
fine.
Maria.
Dia's good.
Awesome.
Dia's good. Not so formal.
This is like a family conversation.
Absolutely. Else I will be all nervous. And this is a deep honor. I'm so proud of your work and deeply honored to be here today.
I'm very grateful for you to be here because as I was telling you like a few moments ago, like I was just like reading about all the stuff that you've made. And something that really caught my attention is that you have a lot of work out there that you published. But it's very interesting that you are such a caring and humble human being, which is a very hard combination to find in this world, I would say. But I want to talk to you a little bit more about from your career perspective, what you do, how did your career start, what did you study first, because I think that's important. Where and how did you become a doctor for UNC Chapel Hill?
Thank you. So it started a few years back. I was born and raised in Mexico City, and I went to Universidad Nacional Autónoma de Mexico, which is the oldest, perhaps oldest Latin American university, public university in the continent. And I got a degree as a physician, medical doctor. Then I moved to the U.S. not planning. I met an American citizen whom I married, and I did the rest of my training in the U.S. I completed a residency in pediatrics in Texas at Driscoll Children's in Corpus Christi, Corpus. I then did a pediatric nephrology subspecialty at UCSD San Diego, and then during that time, I also got a master's in public health, and then when I joined faculty at UT Houston for 9 years, I completed a PhD in epidemiology. So I like schooling. I like to learn. And then I came to the University of North Carolina in the year 2000. I've been here 25 years, 25 glorious years. And I came here because of personal reasons. I was having fun in Texas, except that my son at the time, Michael Ted Ferris, was starting college at the University of North Carolina School of the Arts in Winston-Salem. And I needed to be near him, not in the same city, but we needed to be closer to him because of health issues he was dealing with. And so that's what brought me to Carolina. It was destiny.
Destiny. That was very interesting. I also studied at the same college, which I'm very grateful, and I always talk very high about that university
Yeah.
because it taught me a lot. I even remember I study actuarial sciences there. It's more like mathematics, but in my free time, I would go to the medicine faculty and get some classes and like
Yeah.
just talk to people.
It's a glorious campus, right? I mean, and then to see the Diego Rivera, the library with the Diego Rivera art outside of the building. It's just our alma mater. Just a great, great fun memories. And I'm very grateful for my education. And I
Yeah,
give back as much as I can.
that's also in my near future plans to start giving back somehow. For me, trying to give back to that college, and I think it's important to mention that education in Mexico, in particular, this college, this university, is basically public for free. I think I used to
Almost, yeah.
pay 20 cents of a Mexican peso when I studied there. We used to contribute a little bit more, uh, but basically, our education was free.
Was free? Right. Right.
And it's a very high level education. And what is surprising to me, or what I really like, is that there's a lot of professors there that are fully committed with the institution. And they have amazing jobs, right? They can be making a lot of money, and they would go back to the university and teach basically for free because they feel that compromise with the new generation. So they keep on, like bringing these fantastic professions to the world.
Yes. And I'm very fortunate to collaborate with many of them, many of the professors at UNAM and at the Children's Hospital of Mexico, Federico Gomez.
Mm.
So, yes, you are absolutely correct. The people there are talented, dedicated researchers and investigators and professionals.
Yeah, it was a great time. When you move here to the U.S., did you experience any cultural shock when you move? Because things work a little bit different, right?
I think that's the understatement of the of the day. It was a big change for me. I was married very young. I was really 21. Always lived at my parents' house and then came to a different country. And it was a big adjustment. But I had a lot of support by my in-laws and then at work and getting ready for my exams, passing those horrible exams that took me several times. These are exams that all foreign medical graduates have to take. That gave me an opportunity to learn to work and be an employee, working for minimal salary, doing all kinds of things. But it was, nevertheless, was a nice transition because I had a loving, supportive family here at the time.
I think what you're mentioning is very very important, right? Like all the preparation, and I use this word a lot, all the discipline, because I think studying, preparing yourself for this kind of test, but not only the test, like it's also you are preparing basically for life, and this profession is very demanding, right?
Yeah.
Where is that passion or that discipline coming from?
I don't really know the answer, to tell you the truth. I come from a family of professionists. My father was a physician and a surgeon. My mom is a nurse, no longer working, but she's still alive and is a nurse. Of her 6 children, there are 6 of us. 4 of us are medical doctors. One of us is a dentist, and one of us is a school principal, retired.
Mm-hmm.
But in the table, all we would talk about was my father's adventures in the OR or the interesting case that came to see him. And so we sort of wanted to be like that, right? I wanted to be like my father. The other thing that I want to share this interesting personal story because my father was worried that I wanted to be a doctor. And when I told my mom, I actually told my mom, I want to be a nurse like you, Mom. I want to help patients like you. And she said, oh, no, honey. I was 6. She said, oh, no, honey, you don't know how to take orders. You know how to give them. I think you need to be a doctor. So that was like a challenge, right? But then the other challenge was that my father was concerned, and this is the Mexican culture, nothing against him. It's just the way he was raised. He came to me when I was about 10 or 11, and he said, why do you want to be a doctor? You know, you're a woman. You have to think about having your family. You're not going to be at home and present as other professions. Why don't you do something else? And so I took it the wrong way, and I really took it as a challenge. And I responded to him, not only will I be a doctor, I will be a better doctor than you are. And I was very serious. It was like a big motivator for me. It was a big challenge because I didn't understand why my father was saying, you shouldn't think of this profession because you need to be a mom. And I honor my mom's commitment and I honor mother's commitments. But I also, at the time, and I was again, a young person, didn't understand why I couldn't have a professional life and a personal life at the same time.
And you have 2 children, right?
Three.
Three.
I have 3.
Oh,
I have
that's
3. I have 2 boys and a girl.
How was that? Was that like very challenging when you started having your family and also like, you know, that commitment with your profession?
At the time, I had a good partner. Their father was a very good father. And I must say that when I was a resident and I would work 36-hour shifts every 4th day, and I would come home after not sleeping because I had we call it black cloud. You know, I would have all kinds of patients come in my shift. And so I never slept when I was on call. And I would come home after 36 hours of working hard. Food would be on the table. My son would be taken care of. I would eat. I would go to sleep. So that's how I did it. You don't do it alone. And I also had the support of my aunt who came to help me with my oldest son at the time, Tia Jose, and my mother and my daughter, my sisters, a rotating door and a revolving door in the house where they would come and help me with, at the time, my only son. Yes, having a family is challenging for everybody. It doesn't matter what your profession is. But if you have to work, you make it happen, right?
That's true. Yeah. And let me go back a little bit because you mentioned a critical factor in the Mexican culture because what your dad said, you know, like you as a woman, you had to get ready. But it's not only the concept that our families have or the expectations they have for us, it's also the entire culture, right? Was it a challenge for you to kind of deal not only with the family culture, but with the society culture from Mexico?
You know, by the time I came to the U.S., I came married. I married an American, right? So I didn't really deal with the culture around me in the professional cloud of you're a professional, and then you have children that you're neglecting, right? I didn't have that. What I had was a lot of support.
Yeah.
But absolutely, having a family brings a lot of dimensions in your life that you need to be prepared for. Mostly, you don't sleep very much.
Yeah.
And so you're chronically tired. I don't think it's gotten better, though. Even at my age.
How many hours?
For other
usually?
reasons. 5 to 6 hours, not by design. It's just like you get used to work with little sleep.
Yeah.
And then even if you want to sleep, you can't.
Yeah.
And then when I became an empty nester, my energy went into producing more manuscripts, more publications. So I can tell you that in my last 2 decades of life, or really the last 15 years, I've had the most publications that I've ever had altogether since I went into academia.
Oh, wow. What do you attribute that, like this number of publications?
Being an empty nester, number one. Number 2, finding terrific, great collaborators that I found after an area that I developed almost 20 years ago. And people who want to play with me, I call it come play with me. People who collaborate with, and I have a terrific team of collaborators in Canada, in Mexico, in the US, and across 16 countries. Because our tools that we invented for the area of healthcare transition have been translated into 8 languages. And if I could say something, I'm the most proud of the Arabic version of our tools because those patients have been totally neglected in the area that I work. So I have our tools translated into Arabic now.
Wow. So let's talk about that. So we already talked a little bit about the background and where you're coming from and how you got here to the US. Now, you mentioned this important word, transition, right? And this is, can you explain a little bit more for the people either listening or watching us
Right.
what that is?
Right. So the area that it's my niche now, I guess, if you can call that, and it's really my mission more than my research. It's called healthcare transition, and it's dedicated to help adolescents and young adults transition from the pediatric services to the adult healthcare services, adult-focused healthcare services. Children with chronic conditions have parents at times that are helicopter parents that don't like to let go of. I'm one of them. That don't like to easily let go of obligations of the healthcare, medications, administration, etc. And children survive. Adolescents with chronic conditions survive, have great survival, thanks to changes in the health system and medications, etc. So now we need to prepare these adolescents and young adults become adults and manage their health themselves. And in the last 18 years that I worked in the area more formally, we've learned a lot of things. And the more we discover, the more we know, the more we have to do. For example, if the audience is listening and they happen to have a child with a chronic condition, I would like for them to hear that they will survive most likely and that we need to learn to let go. But one of the findings that I learned in Victory Junction Camp in North Carolina, for example, one of our strong collaborators, is that when we asked adolescents, how do you like to learn about your health? They said, and the options were, I'm going to ask you the question. The options are the internet, a pamphlet, a doctor, your parents, or peers with the same conditions. So of those 5 choices, which do you think they pick the most? The area they prefer to learn about their health the most?
From the internet?
From the internet. You would think that, right?
Yeah.
Nope.
Wow.
No. And the number 1 answer was their parents, which was an eye-opener for us. It's something that I've discovered. It's a lesson from the field, right? Which I totally did not expect. We did that survey 3 years in a row, 3 different summers, all kinds of adolescents, all ages, all conditions, the same answer, their parents. But number 2 is physicians and nurses. And the internet is like 3rd or 4th. And when we asked them, why not the internet? You would think they are adolescents who like technology, who are adept to using technology. And the answer is the internet is for fun. They don't want to go learn about a condition they didn't want in the first place. So some of those things that are eye-openers for us have directed some of the work that we're doing now.
And why do you think like their parents is the first one?
I don't really know because I didn't have a chance to query their answer a little more. But I think that they are used to their parents handling their medications, handling their appointments, handling their health, that they trust them, right? And I suppose, and this is my hypothesis, I don't have a data to back this up, the doctors and the nurses, the relationship is very brief, right? The interactions are 5, 10, 15 minutes a visit. So learning to trust and to learn about their health from them may be a little bit harder. I don't really know the answer to that. Good question. Next. You have another question.
That's very interesting, like I didn't see that coming. But do you think is maybe...
Me either.
And I'm just playing around here because I know nothing about the subject. But as you said, like, they are used to their parents like handling all the situation. But do you feel that they feel also some comfort, like, it's family at the end and they are like potentially the closest people to them?
That's right. I think that's a good point, and I think you're right. I think it's an area that needs to be developed, and we need to learn more about it. But I also have to tell you another lesson from the field, which was another eye-opener, which is when we would give patients, I have a transition survey. The word transition has 10 letters. It's a 10-point score. Oh. It's a long story. It's a really neat transition. And then we have another survey called STAR questionnaire. And we have the child version and the parent version. Mm-hmm. And we developed the parent version by this lesson from the field. So about working, this is the 8th year of my program. And I have my transition coordinator. We're talking and I go like, when I go give presentations around the world, what advice would you tell people out there? You've been working at this 8 years and you are directly in contact with the adolescents and young adults. And what would you tell them? And, she said, bottom line, this family is all they need is love. And that reminds me of a Beatles song. Yeah. All you need is love. And I actually created a teaching syllabus that talks about health called All You Need Is Love, which stands for adolescent and lifelong skills. Oh. I'm not even going to tell you what it stands for. But the other thing she said was, now I have to confess something, Dr. Ferris. You have asked me to ask the questions of the adolescents in the room, in private, so that the parents are not influencing their answers. He says, but there's only one of me. So what I did was I put the parents in the back of the room, tell them not to talk, that I'm going to ask the kid the questions. But here's what I'm learning from the parents. They would come and say, Christy Bigford is her name. I did not know my son or daughter knew the answers to this. Mm-hmm. But more worrisome, I myself, as a parent, don't know those answers. So that was another eye-opener. And some of our work after that in the last 4 years or so has been focused not just on the patient and preparing the patient, but also preparing the parents to learn to let go and to learn about their child's health. So all these things that we're learning in the field, we wouldn't know otherwise.
That was my next question, because it's not only about as a doctor, right? And then you are practicing and talking to patients. It's not about just what you know. It's also how you handle the situation, how you communicate, right?
Correct.
Because I think that's a skill. A skill is to communicate an idea, not only as facts, right? Because you're dealing with people. So there must be like a caring side, like a supporting side of it. Which part is more difficult to handle? The relationship with the young adult or the person who is transitioning, or their parents?
They're challenging in different ways.
Mm-hmm.
You mentioned a very important comment, communication. We have our material and our conversations with our patients are at the fourth grade literacy level. Mm-hmm. Because even if you're a PhD physicist or an economist or somebody like you who's totally overtrained, you don't know anything about my medical terms. Mm-hmm. So you are illiterate in my medical terminology, right? So I need to be able to speak with you in English or in Spanish for my Spanish-speaking patients. I need to be able to communicate with you. And if I start using this jargon, medical jargon, nobody's going to follow the story. Nobody's going to follow the plans or the recommendations. And nobody's going to understand what their conditions are. Mm-hmm. So I have a game for my residents and medical students I play. I ask them when they're rounding with me or they come to the clinic and they have to present the patient to me, I always ask them to do it in front of the patient. So we go back in the room and I said, let's talk about this patient. And I ask permission of the parents. Can we talk about your patient? Yeah, absolutely. And then I tell the students or residents, now you have to speak to me in English so that the adolescent and the parent understand. I involve them, I engage them that way. And I always tell the adolescent, she or he, the resident, will pay you 25 cents for every medical term this person uses. You have no idea how fun that is. One, the patients really do make money because the medical students and the residents forgot how to talk to patients in English. So they're telling me, this patient comes here with right-sided abdominal pain. And I go like, okay, did you understand what this? Well, it's pain in the right side of the belly. Aha! So So communication is so important to avoid mistakes,
Mhm.
right? We have so much to learn from the aviation company, for example. They have simulators, right?
Mhm.
And you cannot make a mistake. That's why you do simulation. So we
Exactly.
treat medical education and patient education and parent education just the same
Mhm.
as a simulation, as if you are in a simulator, because you have to learn to manage these very important medical conditions and complex
Do you have a
medications.
specific training for that, or is that like each doctor has to develop?
Um, some medical schools are now teaching medical students communication techniques and things like
Yeah.
that precisely because of this.
Yeah.
But I don't have formal training. It's just lessons from the field, right? It's just like what you've learned.
Mhm.
And I find myself sometimes speaking medical terminology to them. And I also catch myself and say, I'm sorry, I use this term. Let me make sure we're understanding. Let me make sure I'm clear.
Mhm.
I never say, let me make sure you understand. I always say, let me make sure I'm making myself clear.
Yeah.
It's on me.
Mhm.
It's not on my patients or my parents. It's on me.
That's a very important difference between saying like, "Do you understand?" Of "Am I being clear?"
Right.
It's I think it's very subtle, but I think is very important.
It's a powerful message, right? It gives the patients and their parents the importance they deserve
Mhm.
because it's really an honor for us to serve them.
Yeah.
And we have to treat them with that respect.
Mhm. When you during all your career, uh, I'm sure that there have been like so many different challenges for you, and it can be on many different ways. You know, like it can be the time you have to dedicate to your profession, or specific challenges with a case. Because I understand what you do sometimes is labor of a detective. You know, like you have to do like a you gotta think outside of the box. You gotta like put like all different pieces together. And for someone with this profile, I don't know if this is the case, but you can tell me. Is it like, does it prevent you from sleeping when there's a case that you can't figure out what's going
Right.
on?
You bet. You
Yeah.
bet. You bet. The challenge, and I'm not the only person. I know people that I work with who will think and think and think about the case, and we'll go do homework and we'll ask others. I'm very fond of calling others and say,
Uh,
hey, give me a hand. I don't
mhm.
understand, or please help me. Um, and I have the fortune of being in this institution for 25 years, so I have most everybody's cell phone. So I just text them, hey, do you have a minute? But so I do sleep because I do try to figure that out. But there are cases that keep you up,
Mhm.
and families that you would like to help and have so many other challenges that are not related to their health or their medicine, but social determinants of health, poverty, access to healthcare, access to insurance, access to services. And it keeps us up at night. And we in the health services suffer such a thing as called moral injury
Mhm.
because we witness or hear about cases that are so difficult and you are helpless. Thursday, for example, was one of those particularly difficult afternoons. And I got home exhausted. I was very tired because I was serving patients that were sad and difficult. And there were things that I could not really affect or I could not change. And that also is a challenge for me. So you get home and you um, hug someone or relax and try to do something to debrief because you carry that load.
Mhm. I think that's a critical factor. You know, it's very very important. I feel that for someone to offer help, that person has to be like 100%. You know, or like on their best health possible. You know, sometimes it's impossible just to like do everything for our health. As you said, like there are many different factors. Financial could be one. Access to the services could be another one. How do you
And
culture?
cultural
Yeah,
factors. Yeah.
absolutely.
Do they believe you? Are they going to follow your instruction?
Yeah, and how? Yeah. Like if they follow your instructions. I was just remembering a case that someone was sharing to me. It was this guy from Mexico who works at putting roofs. You know,
Mhm.
like and he had a doctor appointment. He went to the doctor, and the doctor told him, like, like you have something. I don't remember what that is, but the doctor said, like, you need immediate rest. And the response from this worker was like, okay, doc, okay, that's cool, but just let me finish this rope for today, and then I'll go back home and get some rest. And that's like the cultural factor too.
Right. Well, and also, how are you going to tell that person not to have income?
Exactly.
Right? You have to rest. Well, okay, I will rest, but then how's my family going to be provided for?
Yeah. Last time, well, I think 2 or 3 episodes, recorded episodes, I was talking to people who study history, and we were sharing a lot of stories, and they told me, like, health is secondary. You first need to survive, right? If you don't have food or shelter, maybe health will come after that.
Right.
And that really made me, or reminded me, like, where I'm coming from Mexico, because not everybody in Mexico has access to, well, the system works different in Mexico. The health
Right.
system is very different from the health system in the US. Potentially, people in Mexico have more access to health services depending on where they live. But I think the system is designed, let's say, different. Let's say
It's different.
different.
And it's also ever changing.
Yeah.
Just like here, ever changing.
Yeah. But that was very important, because since maybe I was a kid, I thought about that. Like I've been here in the US for 10 years, and I didn't remember that that's true. Like, health comes after, like, your basic needs. And I think, as you mentioned, like, as a doctor, like, when you see those cases, that can be, like, morally uh, tough for you. What do you do to take care of yourself?
Um, I actually, therapeutic for me
Mhm.
is to clean house. I love to clean the house. It's just come and clean, and cooking.
Mhm.
My team always knows that they would used to joke, because I would come on Monday with goods that I have cooked and baked and everything. Like, oh, Dr. Ferris is stressed. So I try not to do that, because I don't want people to know when I'm stressed or not. I love to listen to music,
Mhm.
all kinds. I love opera. Opera to me is very therapeutic. I also like classical music. One of my dear friends taught me about Camille Saint-Saëns,
Mhm.
and who is the one that Carnival of Animals piece. But he's just a fantastic composer. I like walks, and I like reading a good book or listening to a good book now, because
Yeah.
time is precious, and so now I have audiobooks, and
Mhm.
I get into those books. And I get very sad when I'm about to finish a book, and I know it's finishing, and I like have withdrawal. Okay, I want more. I get upset.
What kind of books do you read?
I like all kinds. I like the whodunit murder mysteries.
Ah.
I like Tom Clancy.
Mhm.
I like but it's kind of scary. When 9/11 came, I sort of stopped reading those books because it was so close.
Ah.
And I like, but I really like things where I have to figure out.
Mhm.
The last series of book that I completed, believe it or not, was the Hunger Games.
Mm.
It
You
was a
like
little
it?
violent,
Yeah.
yes, just a bit, but it was very entertaining. The Lord of the Rings trilogy and everything. I just
Yeah.
love to read that.
There is a friend of mine was sharing with me. He's a neuroscientist, and he was telling me people who read this kind of fictional books, they are very smart,
Oh,
because that really takes your brain. You have to recreate everything. I mean, partially is also how the author is putting that into words. But people who really like that, like, it's like a workout for the brain. You know, and I'm very surprised to hear that answer. I was expecting something more like books about medicine, you know, your
No,
field.
no, no. I like science fiction. So it's because I was reading medicine most of my life.
Yeah.
When I finished until I finished my fellowship, I like caught up with all the things I have not read.
Mhm.
And now, I should be going back to reading, but my free time is spent on writing manuscripts and trying to produce more evidence. And so I read more technical books,
Mhm.
but not for joy.
Yeah.
Meaning, yes, it is enjoyable, but it's not relaxing.
Yeah.
What I'd like to do for relaxing is what I said to you. I just like to look at series and books that have great scenery. The movies, to me, for example, Lord of the Rings, outpace what I had imagined in my brain when I was reading the books.
Mhm.
And I always like to read the books before I see the movie.
Mhm.
And I would make my children read the book before I would take them to the
that's
movie. Not necessarily appreciated, but
I can see that.
but I'd love to be rewarded with wonderful scenery, cinematography. I'd love that.
I don't know if you know Haruki Murakami, Japanese author. I'm gonna share some books with you because
Okay.
you mentioned two very characteristical factors that he uses on his writing. One is he is very descriptive, and he's great at that. The other thing is that he's obsessed with the Beatles.
Okay.
And you mentioned one of the songs.
All you need is love. Yeah, I love the Beatles.
And he makes a lot of references to the Beatles songs.
Uh-huh.
And yeah, there are like a few books from
Yeah.
him that I'm gonna share. I think I have one here after
Okay.
the recording.
looking
I'll
forward to
share
that.
it with you.
You know what I would like to tell you is you need to ask me, if I was to be born again,
Mhm.
would I do this again? Or what would be my second career, right? If I retire, whenever I retire, which I don't see in the near future. But I'd like to tell you that if I was born again, I would do it all over just the same.
Mhm.
But as my hobby, I really would like to have formal training. I love theater, but I like the staging. So I would love to be trained on setting the scenography and the dressing,
Yeah.
the costumes. I think that is fabulous.
Yeah.
I'm not talented, but I would love to be trained on that and just work in the theater in the back and just be sewing the little dresses or the hat or something.
Do you do it now?
No, I
No?
want to learn at some point, but no, I don't.
It's never too late to
I
learn
know.
new skills.
Oh yes, that's right.
When I was in college, a professor told me his theory about the happiness triangle, and that was interesting. In general, triangles for me, the shape is very interesting. In fact, the logo for this podcast is a pyramid. A pyramid is like a three-dimensional thing, right? But if you project the light on the pyramid and then you project that on the wall, it's going to be a triangle. right?
Correct.
That's basically the essence of why there's a triangle there. But it was interesting to me that theory, and he was like, for someone to keep balance, they need to have three aspects that they have to constantly work on. One is intellectual, like how do you feel good about your intellect? Like how do you intellectualize concepts? That's one. The other one is something artistic. Like how do you understand the essence of life? How does life run through your veins? And the third one was a physical activity. He was like, if someone can balance those three aspects in life, that person will be potentially good. Like probably less signs of depression, stress, anxiety, etc. Which I don't know how he came with that conclusion. I have no clue. But I think so far it has worked. And you were mentioning like the three aspects, which was very interesting to me. Like what you do is very intellectual. Then going for walks is your physical activity. And then this liking for opera and this, it's not conventional. Opera in particular is not that conventional. How did you develop that taste for music?
When I was growing up, I just kept hearing it at my house. My aunt, Tia Jose, particularly, she taught us a lot of things about opera, ballet. She would take us to the symphony. My dad, my mom. You have to really be exposed as a child to understand it and love it. But not all my siblings, for example, are as fond of it as I am. Some of us are, some of us aren't as much. But the reality is, we were all exposed to wonderful music, and we all played the guitar. We all played in the church and sang in the choir, and so we were a very artistic group. Not the best in the world, but we sure tried, right? So I think that you're right. I think that, in your family, if you have the opportunity to develop something artistic, you're both sides of your brain, right? The left side and the right side of your brain, you're a little bit more balanced.
Yeah. And now let's go back to what you were saying about if you were born again, like you said you would do it like everything, like as it is, right?
Professionally speaking, and personally speaking, yeah, why not?
Yeah.
I have fabulous friends now. I have fabulous children, 2 grandchildren. So yeah.
That's really interesting because I don't know. I mean, I would say yes. I would have exactly the same life, because there is no guarantee that if I was born again, life could have been better than the life I have right now.
It's true.
Or worse. Nobody knows, and I think that's a very important reflection to just appreciate what we have around, and like enjoy it. Like life is like similar to a roller coaster. You're gonna be like at the top, you're gonna be at the bottom, and not only professionally, personally, in so many different ways, right? But the thing is, it's a wonderful journey.
It is, but I think that in all through your journey, in my view, you have to be grateful for everything that comes your way, the good things and the bad things, the challenges. You always have to be grateful. And I think that I'd like to use a term I learned. I'd like to be a giver. And that is, to me, has been a key, because the more I give, the more I receive from friends, from my family, from patients, from everyone, my staff.
Yeah. And now let me start putting like some of the topics that we have been discussing, because I believe that a life purpose is when someone does what they love, but that action helps others. And I think that's when someone fulfills that passion or purpose in life. Professionally speaking, do you think what you do is your life purpose?
Absolutely. What I do makes a difference on patients' lives, on parents' lives, and on my own. So yes, I have been blessed to work in an area where I know I am impacting people's lives directly. But I also get paid for it. I would do it for free.
Yeah, I understand. I understand that. For me, my biggest passion was music, and that's one of the reasons of why I'm doing this. Because it requires some. I mean, I love sound. And that's one of the reasons of why this is called the art of listening, because that's a skill that we all have to work on. Again, I think sometimes we are just like caught in our own heads, and there is a lot of valuable lessons out there. Sometimes it's just that we are not ready to listen to them. But I'm really grateful for this conversation. And again, like I want to reemphasize like this feeling of like respect and admiration I have for you personally and professionally. But before we start wrapping up, what do you think have been the most challenging parts of your job?
Not well. One of the most difficult parts of my job was to pass those horrible exams. It was very challenging. It's like literally changed my life when I passed them. But if I had not passed them, and many people don't, I would not have been blessed to have all the opportunities I've received. But that was very challenging, and it took several tries, because I'm not. While I could consider myself smart and a decent brain. I was not used to taking those exams, and it was very challenging. It was very frustrating to me. Never have not passed anything in school. So that was very challenging.
Yeah.
So The other challenge is how to help patients uh, achieve health by removing barriers that I have no control over, like behavior. Like the adolescents are very challenging because they don't take their medicines the way they're supposed to.
Yeah.
So that's a big challenge for me. How do I motivate them? How do I teach them? How do I tell them, look, stop being an adolescent. Please take care of your kidney. Please take your medicines, because not everybody gets a kidney and you're wasting it by not taking your medicines. Those are very big challenges. And I don't know the answer. Many of us don't know the answer on how to change adolescent behavior.
Yeah.
Negative behavior.
Negative behavior.
That has all these consequences, life consequences.
Yeah. Do you feel frustration when they, or what's what you feel when
sadness?
Sadness.
I get very sad because when adolescents, and I'm a kidney specialist, right? When they receive a kidney and they don't take their medicines and they lose it, they affect the adolescent themselves, the donor of that kidney, and the parents, the family around. So it has great consequences, and so it makes me sad. It doesn't make me mad. It used to, like, I didn't understand why are you not understanding? It's not. I don't get mad. I get sad, very sad.
Yeah. Yeah, I can see why that is sad. Because it's, I think I would feel helpless, like maybe even hopeless, because there isn't much I can do.
It's frustrating.
And sometimes, I mean, I love my parents, but sometimes I behave in that way.
Like adolescents. Oh, wait till they get older. As we get older, we become toddlers. So just hang on.
Yeah,
just wait.
That's true.
All you have to remember is they did everything for you.
That's true.
Okay.
Yeah.
And you're here because of them, right? So yeah.
Yeah, and they've done so many fantastic things.
Right.
Like raising my brother and I and giving us education. And that's what I admire a lot about them. And I think that's the kind of the blessing of being a parent, You detach yourself from yourself, basically. Like, they didn't have the education I was able to have, and I think that's, for me, that's kind of the definition of love. It's like you provide someone else with the opportunities that you couldn't have, and you do it without any type of personal interest. You truly do it because you want that person to be good and successful. And that's kind of what most of the doctors do, like they are like, I'm here to help you in the best of my abilities to, have a healthy life.
Right.
And I can see like why you feel sad when they are not following.
Yes.
Now, one of the questions I have for you. I know this world of science, medicine, sometimes can be very challenging, but what I'm getting from you is that you have built a community. And a lot of the good work that you've done, it's also because of that collaboration that you create, and that to me is very important. I always believe that collaborating it's key even before competition. Some people would think that competition comes first, but I think collaboration is very, very important. What do you think about that? Do you think collaboration has played an important role on your development, success?
Absolutely. It takes a village. You're not alone. You cannot do it alone. You have to create friendships, collaborations, trust. And now in my role as a professor, full professor, I get the opportunity to collaborate with younger students, learners, younger faculty. And while I a mentor, they also are mentors to me. So yes, collaboration is key on successes, and on it's like having your friends around.
On that same regard, and on a personal aspect too, who do you admire and why?
A live person, a live person,
It
or
doesn't have to be alive. Hmm.
I admire many people. My mother. My
Hmm.
mother is an amazing woman. My grandmother, maternal grandmother. Um, my maternal grandmother didn't know how to read and write, and came from a little town in Mexico. Came to Mexico City, and uh, raised 3 children after leaving her husband. At the time, a grandmother divorcing her husband because of whatever reasons, and she went to work as a maid for food for my mom and my aunt and my uncle.
Hmm.
And she did not know how to read and write. And when I was in first grade, she and I learned how to read and write together. And she was an amazing woman. I come from a very strong family of very strong women.
Hmm.
And then I admire my mother for raising the family that she did, that she has. My aunt who helped, Tia Jose.
Hmm.
My father. So those are, to me, my siblings. They're my heroes. And I admire a number of friends that I currently collaborate with, um, uh, both in Canada and Virginia and other states.
Hmm.
Um, I think I have heroes, but my heroes are close to me. Heroes that I know,
Yeah.
deeply know. Yes, I admire Einstein and people like that, prominent scientists.
Yeah.
But I don't know them to understand where all of this came from, and so I'm very simple in my heroes. They're close to me.
And I think that difference that you're making is important. One, because I think an outlier like this scientist, like Einstein or Thomas Alva Edison, or
Right.
Tesla, I think they can help people with inspiration, but inspiration can be temporary, you know. But the ones who really set an example are those ones who are with us through life,
Yeah.
and who really teach us how to navigate the paths of life.
Yeah.
There was a comedian in Mexico City that I personally I'm not a big fan of his TV shows, Chespirito.
Everybody knows him.
Yeah, and he's so famous in Latin America, so famous. But I really respect his concept of this character that he created, this superhero. Uh, for the people watching in English and who are not familiar with the Latin American culture, this was potentially the most successful TV show ever in Latin America.
It compares to Sesame Street, that's the type of penetration,
Hmm.
right?
Yeah, yeah, it was impressive.
You were growing as a child with him.
Exactly.
Chespirito, your superhero.
Hmm.
Yeah.
And his concept of a superhero is not that person who is fearless or who can fly or can like destroy a building by punching it. His concept of a superhero is that person who is able to face their fears. Someone who has fear, someone who maybe even scared of lots of things, but they still face those challenges.
Yeah.
And I think that's a very accurate definition of,
Right.
of what a superhero
Right.
to me is.
But to me, my superheroes also are my patients.
Yeah.
They're amazing, resilient. They make, I used to, you've heard the expression in the US, life gives you lemons, you make lemonade.
Yeah.
My patients, life gives them limes, and they make margaritas with They're amazing.
Yeah. I don't know if I asked you this before. Uh, Dealing with patients, have you ever learned a life lesson from them that you were not expecting?
A life lesson.
Yeah.
Their resilience,
Hmm.
their positive thinking, that despite every challenge they have, their positive outlook, and they'll keep trying.
Hmm.
And they'll come to the dialysis unit every time, and they still come and smile.
Yeah.
That's a life lesson.
Yeah. Yeah. Yeah, that's him. I know a few people who, despite having very complex situations in life, could be health, could be financial, could be anything, they still come to you and they laugh, and then you start wondering, like,
Yeah.
why am I bothered because I couldn't finish my job today?
Yeah. My oldest brother, Agustin, he's a dialysis patient, and you can see him smile and dance and sing, and will tell you, you'll ask him, how are you doing? He says, I'm great. I'm
Yeah.
super, you know?
Mhm. I think that's, I don't know who said this, but what your body feels is one thing, but your state of mind, that's something that you can totally modify. Like your approach in life, like when you decide to laugh, to smile, or even when you decide to be sad. Uh, I think, yeah, the mind in that way is powerful in that regard, because at the end we have that decision. We are the ones who made that call. If we're going to be sad, if we're going to be bored, if we are going to be angry, upset, what we take in life is totally our responsibility.
Right.
What message, after all these years of research, hard work, but also like happy moments, what do you think is an important message for a patient with this kind of diseases to hear?
Keep at it.
Mhm.
Trust your doctors. Trust your nurses. And, you will survive. You will become an adult and learn to manage your health, because your parents are not always going to be there. That's a message to the patient.
Mhm.
And I always like to tell them, you're not alone. We can help you with this load. I just hope that they hear that
Yeah.
when I tell them that.
And to the parents?
Stop being a helicopter. Helicopter parents are not very good. and this too shall pass. Your child will survive. Your child will not fall apart without you. And you just have to make sure that happens. You have to give your child the weapons and the tools, and trust your child. Trust that what you've done and is going to work.
Yeah. Thank you so much, Tia. Just have like a couple of like random questions. What's your favorite rock band? Because you also listen to rock every now and then, right?
Queen.
Yeah.
Queen. I'm going to say Queen, but I like several.
Mm-hmm. Yeah. Mine too.
It's yours. You like Queen?
I love Queen.
Oh, Queen is
when they released
he's
the
so
movie.
Talented.
Yeah. Did you watch the movie?
Oh yes, I cried.
Yeah.
Yes, yeah. My brother Antonio told me Queen so much more, the whole story. He's a big, humongous fan.
Yeah. Yeah, I love rock. In particular, Queen has that combination of this type of opera.
Oh yes,
how they assemble.
He was trained. He was right. Yeah.
Mm-hmm. Yeah. I kind of had that idea that you would say Queen because of that combination of different styles. What's your favorite book?
I'm gonna say the trilogy of the Lord of the Rings.
The Lord of the Rings.
Yeah, I'm gonna say that.
Mm-hmm. And movie?
Those movies.
Oh.
The movies.
Yeah.
And the book. I have many favorite books and many favorite movies, but I think the Lord of the Rings is like especially number 3.
Mm-hmm.
And there is one part I like. My kids make fun because when the king is, getting his troops all in the final battle,
Mm-hmm.
he says, you can have fear and you can be worried, and the bad guys are coming, but not this day. So, so as a joke, my kids and I go, not this day. That's my favorite scene of all the trilogies.
I like movies. I just wish I had more time to watch movies.
Yeah.
Because you can learn a lot from, I mean, depending on the movie, right?
Yeah.
I don't know if someone can learn a lot from, I don't know, like some of the Mexican movies like La Risa en Vacaciones or some type of that. I mean, there's movies for all kind of
right.
I was actually talking to some of the guests the other time. It seems that humanity is not that far away from getting to Mars. And I was thinking, because I heard this from a radio show, the radio host, he admires Stanley Kubrick. And
That's 2001,
yeah.
Space Odyssey. That's a wonderful movie and book.
And he was making this reflection, which I didn't think about, but I think it's very accurate. He was saying that Stanley Kubrick may feel very disappointed in humanity because when he created these movies, he thought that humanity would go to Mars just for the sake of expanding human consciousness, like who we are. We are exploring outside of this planet. But seems that the real motivation for humanity to go to Mars is purely economical and resource driven, which was kind of disappointing.
Oh,
But yeah, I think that's my point of like, depending on the type of movie, you can get different type of messages. But yeah, I just wish I had more time for that.
yeah, right.
Yeah, this has been a pleasure. It has been.
It was my pleasure too. And I have to say something. One more thing about my children and grandchildren are amazing, but but the most important thing is that family. It keeps you going. I wake up every morning excited to go to work, grateful to go to work, because I know that I'm helping patients and I'm helping my family and I'm helping my children. And I think I'm just a very lucky person in this world, and I cannot stop counting my blessings. Grateful.
There's a beauty behind that thought process and that behavior of helping and serving others. And I think it's very misunderstood. But I think, at least to me, that's one of the key factors to really find happiness. When someone starts helping others, it's easier to find happiness within ourselves.
I agree.
Thank you so much, Tia.
Thank you for having me. I appreciate your conversation.
And I appreciate all the work you've done for humanity, for sure.
Well, and I appreciate what you're doing, and good luck with your TAOL project.
Thank you. Thanks so
and
much.
I'm sure I'm mispronouncing it, but
no, that's perfect.
Good luck with your project.
Thank you so much.
Thank you.
And thanks everybody for being here. This was TAOL Global, a podcast by TAOL Project. See you next time.